For decades, the doors of the Law Foundation have been open, welcoming in members of our community seeking help with access to basic rights, such as housing, health, and education. But when the pandemic struck last spring, life as we know it was brought to an abrupt halt, dramatically altering the landscape in which we interact with one another.
When we moved to shelter in place, it was a massive change for everyone, both in terms of technology, in terms of how are we going to communicate with our clients who normally would be sitting in our lobby and no longer can even walk in our building. So that was the first priority, is how were we going to manage representing all these clients every day when we couldn't meet with them in person or oftentimes even see them over a screen.
Immediately, the Law Foundation sprang into action. With staff members supported in their new home offices, they quickly mobilized to create new ways of engaging with clients and addressing their pressing needs. One of those needs was to keep people safely housed.
We were in a housing crisis before COVID struck. People were facing eviction, people were facing homelessness in our county. What happened with the pandemic is it just exacerbated the housing crisis because more and more families, as they lost income, as they got sick, were more at risk of losing their housing because they just couldn't afford to pay rent. We think of the pandemic as a public health crisis and we need to protect people, but homelessness is also a public health crisis.
With thousands at risk of losing their home, the housing team successfully advocated to get strong eviction moratoriums passed that would protect clients if they couldn't pay rent due to a COVID-related issue. With the moratoriums in place, they then shifted their resources to educate people on their rights during the crisis.
A lot of our work's really shifted on how do we get the word out, how do we educate people, how do we educate the people who serve our clients? And we did Facebook Live events in both English, Spanish, and Vietnamese. We did Zoom outreaches. We outreach to school districts, to community centers. And the ultimate goal, we hope, is that people know that they can assert their rights and be safe from eviction.
Preventing homelessness is critical in protecting the health of our community. But an equally high public health risk was emerging in another area: our local jails.
As the media has shown, obviously jails are one of the places where COVID outbreaks tend to happen. It's really difficult to social distance in a locked, incarcerated setting. So we have been doing active monitoring and investigation of our local jails. We've spoken with folks there, both who have been exposed to COVID or others who have concerns about COVID. And we've spent a lot of time talking with family members of those inside to try to advocate for measures to protect them.
Ensuring the physical health of those incarcerated was only part of the battle, though. As the pandemic intensified, so did the mental health crisis.
The pandemic has been isolating for everyone, but it's even more of an issue for our clients who have mental health disabilities, who might be living alone, not able to access their therapists or other treatments. So we really went into high gear making sure that our clients could continue to receive treatment, especially our clients that were in locked psychiatric facilities and really needed regular and consistent treatment.
Maintaining connection and consistency is essential not only for those who struggle with mental health, but also for the most vulnerable in our community, our children. One of the most important connections the Law Foundation worked to maintain was the one between foster youth and their families.
Most of our clients, they're out of their parents' custody. They're living with a relative, a foster parent, a family friend, and the reflex reaction, so to speak, was let's figure out ways that we can make sure that these families keep in contact, but do it virtually. And we also wanted to make sure that we kept our eye on how we could support in-person contact. And so we got to work with some of our court partners to fashion an order that struck that balance between how do we respect the public health considerations while also trying to keep these families together as best we can.
In addition to keeping families together, the Children and Youth team also worked to help teens who needed separation from an abusive partner.
From the outset of the pandemic, we made sure that all of our lawyers and all of our social workers who support providing services to victims of violence were able to make sure that if a restraining order was needed, we could get that filed timely. If a youth needed help with putting together a safety plan to leave an unhealthy environment, that they got that support from our staff.
From the outset of the pandemic, the Law Foundation has worked tirelessly, adapting and creating innovative solutions to provide access to justice for everyone. But the work doesn't stop there. As the needs of the community evolve, the Law Foundation is ready.
We are beyond planning for tomorrow, and now we're planning for much further out. We know that our clients that have special education needs are going to have long-term impacts from learning loss. We know that our clients who were unable to pay the rent are not going to be able to catch up and may at some point be facing civil debt from their landlords. We know that our clients who normally would have been able to access regular treatment are going to backslide, and they're going to need more support than ever from us and our team.
There's a long road ahead, but the Law Foundation will continue to meet the moment.
The coronavirus, it's a once-in-a-lifetime crisis. We took it to heart that this pandemic could really devastate our community if we didn't take action. When we look back at this time, I'm hopeful that we can say that the Law Foundation met the moment and responded to this crisis in a way that really kept Silicon Valley a place where people could live and thrive in.